We know that high blood pressure is a major risk factor, probably the major risk factor for cardiovascular disease.
So blood pressure is actually just the pressure that we measure in your arteries when the heart contracts and then the heart relaxes. So the top number of blood pressure, called the systolic blood pressure, is the number that we get when the heart contracts, and that's the pressure that pushes against the inside of the artery. And the number on the bottom, which we call the diastolic blood pressure, is the pressure on the inside of the vessels when the heart is relaxing.
Normal blood pressure is considered less than 120 systolic and diastolic of less than 80. The next level is elevated blood pressure. That is constituted by a systolic of 120 to 129 and a diastolic of less than 80. Next we have high blood pressure or hypertension stage 1, and that's considered a systolic of 130 to 139 or a diastolic of 80 to 89. This is followed by high blood pressure or hypertension stage 2, which is 140 or higher on the systolic or 90 or higher on the diastolic.
Another name for high blood pressure is hypertension, and ultimately when you have hypertension, it's important for you to sort of get checked by your doctor on a regular basis. It can cause a weakness in your heart. It could increase your risk of blockages in your heart. It could increase your risk of stroke. It could increase your risk of kidney disease. These are all major medical conditions, and the sooner we find out about them, the better off, because then we could treat them adequately.
If a person has many risk factors for heart disease or already has heart disease, controlling the blood pressure is a way to slow the progression of the disease or prevent further damage.
So the majority of the time, patients don't actually feel any symptoms with high blood pressure. That's why it's called the silent killer. And that's why majority of the time it's the most common cause of other cardiac diseases like heart disease, for example. So really the only way for you to truly know if you have elevated blood pressure is to go to your doctor and get a wellness visit.